PHT is important to hospitals because they focus solely on healthcare.
You're taking member organizations, hospitals that are trying to achieve the same common goal, working together and collaborating to improve performance, whether it be in workers' compensation, malpractice insurance, general insurance, to do the right thing and benefit from each other's experiences.
40 years is a long time for an organization to be consistently and constantly serving the needs of a particular constituency. And I'm very pleased and very proud to be a part of an organization that has that track record.
Palmetto Hospital Trust was a first collaborative effort of the South Carolina Hospital Association. And it's been a great thing. We have saved a lot of money, not only for individual organizations that have stayed involved in it, but we've through the services, the risk management services and the prevention services that PHT has provided to the organizations that have participated, they have prevented a lot of accidents. And so it's all the hospitals that have participated have benefited not only financially but also making their workforce and their environments much safer.
In the early 2000s, drastic changes came about in the program, primarily for the members, by the members. We've got a claims and risk management committee made up of primarily safety managers and others that drive the initiatives, the risk reduction initiatives. They were successful in doing that, and the members did it.
I would say that PHT is a novel approach to trying to handle the same problems without doing it on your own. It is a way for a group of like-minded organizations to come together and benefit from each of the other member organizations as well as from your own.
I cannot imagine having another company represent Spartanburg Regional.
PHTS is an entity that takes care of claims and getting you through the maze of dealing with claims with workers' comp. They offer a wide array of educational services. They are individuals that are available to you. You feel free to contact them about information, guidance, and they're always available.
Besides having claims management available, they also have unparalleled risk management available. And they are able to identify what the biggest risks are in each hospital. Some are different, some are industry-wide. And then figure out a way to stop those risks with different programs that they've come up with, they design, and they administer it.
The risk management services and educational services that they provide their members are unparalleled. And through the years, they've been champions of risk management, and they've been champions of education.
One of the hallmark initiatives that's been developed by PHT is the transitional duty program, which is absolutely incredible, because what that does is that really gets the employee who's been injured or ill back to the workforce, performing some part of his or her work or some type of work to show them that we really want them back and we're really going to support them in getting them back.
Unless it's a medical necessity for our associates to be out of work, it's much better for them to stay at work. Their pay doesn't change. They know they have a job, and they know that we're treating them medically in every way, shape, and form that we can to get them back to work happy and healthy like they were before their incident happened. And PHT is with us there, shoulder to shoulder, just helping us along the way to make sure that transitional duty is met and that we're helping our associates.
The thing that's unique about PHT is that we not only focus on reducing the cost, but we also try to improve the safety of our employees. And so that's one of the things the services that PHT provides, you don't normally find those with a commercial insurance company.
We help the members to succeed, A, by controlling their cost, but also by making sure that the injured workers are back at work, preventing injuries, which improves the morale, it improves the work environment. If people actively see the hospital working towards safety, they know that that employer is caring for them. They're providing safety in the workplace because they care about the employees.
They've helped us reduce the number of injuries that employees have, whether it's from lifting, whether it's from slips and falls or other injuries, and that has made a real difference. It's helped us emphasize the safety culture that we want within our organization, and they work very much collaboratively with us.
Data makes it very compelling from the fiscal standpoint as well as the human standpoint, because we can break it down to exactly what job classification may be impacted by this type of loss, down to the floor if need be for a specific member.
Our role in benchmarking that data is very valuable to the members because they can see where they're doing well and where they may need some additional help. And then we're there to provide them that additional help.
Not only are we talking about dollars and cents, but we're talking about people's lives, their health, not having injuries, and really quality of life and quality of workplace. You can't really have a quality workplace unless you have a safe workplace. And that's the emphasis, and that's PHT has a strength to help you accomplish that.
The stability of the workers' compensation rates that we pay has really helped us predict our expenses. In an era where we see income change unpredictably year to year based on volume, based on payer mix, based on changes in how Medicare, Medicaid, Blue Cross pay for various kinds of services, it's increasingly critical that we be able to know what our expenses are, get a handle on them, and in particular avoid unexpected increases and jumps or spikes in those expenses.
The refunds are always welcome. Our facility mainly receives Medicaid and Medicare funding, and I know the years when that funding was cut, the refunds helped us not only with our cash flow, but a lot of times we applied it right back to paying for our workers' comp program and sustaining it.
It's not about PHTS and or staff that has led to the program's successes. It is the members. Without the members, none of this would be possible. The members should be celebrating this 40-year milestone as it is really, truly a milestone.
It's really bigger than PHTS as a whole because we're all in this together as member hospitals. And again, healthcare is changing so rapidly. We need to come together to utilize programs like PHTS to really help us not just survive the changes, but to thrive while our industry is changing.